Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. Today, my guest is Dr. Tom Farley, a leader in public health practice for several decades, most notably as the health commissioner for the New York City Health Department and the Philadelphia Health Department. Our topic today is one that has been dominating the news, dominating discussions among parents, and shaping national policies on vaccines and environmental health. That topic is autism. Now, Tom and I are not experts in mental health or developmental diseases, but we are physicians and epidemiologists who have been working on public health issues for decades. We know how to look at data to answer the types of questions that we all care about. In the first part of our series, we asked the most basic question there is there an autism epidemic? After looking at the data, we concluded, yes, there is in fact a real epidemic of autism in the United States. In the second part of our series, today's episode, we're asking the question, so what are the possible causes of the autism epidemic? So Tom, to understand what the causes are, we have to know something about the biology of the human brain, because this is a condition that is, as we know, is a human brain condition. So what do we know about the biological mechanisms of autism?
Well, here's what we know is that during pregnancy, as the fetus's brain is developing, the brain cells proliferate and then they migrate to the areas where they're going to be for the rest of that child's life in that brain. And once they find their locations, they then build connections to other brain cells, other neurons in the network. So they're kind of like transistors on a computer chip that they're sending messages back and forth. In autism, it appears that the brain cells overgrow, but that have fewer connections to other brain cells. So actually, children with autism may, if anything, have a larger head, larger brain than children who don't have autism, but again, have fewer connections. So there's a lot that's not understood there, but that does point out to the idea that if we're looking for causes of increases in autism, we ought to be looking for what's happening during that child, that brain, during the time that brain is developing. That's generally in the first half or maybe the full pregnancy. So it's pregnant women or earlier. It's women when they become pregnant. It's not children after they've been born.
Yeah. Oh, that's a really interesting perspective. I hadn't really thought about that. Oftentimes when we think about autism in a social setting or in terms of social functioning, we think about people with autism, at least classically, as people who may be very intellectually gifted in a few narrow areas, but they have difficulty connecting to other people, connecting emotions and things. And so it's interesting when you point out that some of the neurobiology almost seems to replicate that, right? Like there's potentially an overgrowth or, too much development in certain areas, but too few connections between those different areas in the brain.
Yeah. And again, there's a lot that's not understood here, but that's at least that kind of the gross picture of what we know.
Okay. So now when we talk about, what could be impacting the development of a baby's brain, unfortunately, a lot of the discussion has been dominated by a theory that we're going to just put aside for the moment. And I'm going to briefly explain why. We're going to say that childhood vaccines are not the cause of the autism epidemic. There have been a huge number of studies done on this topic, and I'm going to briefly summarize them. There have also been some excellent scientific and plain language explainers out there that have been written about this topic, so Google is your friend. But let me briefly summarize why we, as epidemiologists, physicians, and public health leaders, can say with an extremely high degree of confidence that vaccines are not the cause. First of all, there have been 16 incredibly rigorous, well-done, controlled epidemiologic studies exploring whether or not there is an association between autism and whether you got the measles, mumps, rubella vaccine, whether you got thimerosal, which is a preservative that is used in some vaccines, and whether you got simultaneously vaccinated with multiple different vaccines, multiple types of vaccines. So 16 rigorous studies that have looked at things like the MMR vaccine, thimerosal as a preservative, and getting multiple different vaccines at the same time. Together, these studies have included more than 1.8 million children. That is an enormous sample size when you look at public health. That is the definition of big data. And the analyses consistently show in these rigorously done studies no association between the vaccines, thimerosal and vaccines, or getting multiple vaccines and a relationship with autism. One of the best of these studies was done in Denmark. And in this study, researchers analyzed data collected from all the children born in Denmark between 1909 and 2010. And, we epidemiologists, we love studies that are done in Scandinavia. Sure, they are not representative of the, racial, ethnic composition of the world, but they have incredibly good data, excellent healthcare systems where there's universal access to healthcare. So all children born in Denmark between 1999 and 2010, that include 657,000 children. Of those, 6,517 were diagnosed in autism over that 10-year period. And they found no increased risk of autism or any other developmental disorder among those who received the MMR vaccine when compared to those who had not gotten the vaccine. So that's my sort of brief summary of this issue right there. And so now we're going to put vaccines to the side, as I hope we will all do, both in our parenting lives and in our policy lives. And now let's focus on the real thing. There is clearly an epidemic of autism when you look at the data. So what are the risk factors that we know about, and what needs to be studied further, Tom?
Well, first, we know that genetics is really important here. Boys are about 4 times as likely as girls to get autism. That's always been true. We know that siblings are much more likely to get autism. If one child has autism, the chances that his brother or sister going to have it is 3 to 18%. We know that if one identical twin has autism, there's maybe 35% chance that the other identical twin has autism. So this happens in children who have a genetic vulnerability. But we also know that genes are not the entire story, because if the genes were the entire story, we wouldn't be seeing this increase over the past 30 years. And we have other risk factors that have been found. So the other risk factors I would all put under the broad category of our environment. Now, when most people hear the word environment, they think about chemicals in their air or chemicals in their water. And that's part of our environment, but our environment is much broader than that. Our environment includes the food that we eat every day, the drugs that we take voluntarily, or the prescription drugs or street drugs, our daily experiences, the structures we occupy, how much noise we're exposed to, the temperature, electromagnetic radiation, as well as chemicals. So the word environment is very, very broad. And we say that some kind of changes in our environment have probably occurred over the past 30 years that are putting us at greater risk. The risk factors that we know of beyond just genetics are, first, an increased age of the mother or father, a deficiency in folic acid, prenatal use of certain specific drugs, air pollution increases the risk, infections during pregnancy increase the risk, preterm birth, children who are born early also at higher risk, and then obesity in the mother during pregnancy, or obesity before pregnancy increases the risk. Now, those are known risk factors. Those may explain why one child is more likely than another child to develop autism. They don't necessarily explain the increase in autism over the past 25, 30, 40 years. So to me, now as an epidemiologist, I would think, well, what of those risk factors, which one of those have been increasing that time period? One thing we know that's been increasing is that there is increasing use of a variety of drugs during pregnancy. Women are prescribed an awful lot of drugs during pregnancy that take an awful lot of over-the-counter drugs. I worry about the potential risk of those to autism. No hard data there, but it's not just something that I worry about. Obesity absolutely has increased during this time period. Could that explain the entire autism epidemic? Probably not, but it's certainly something we ought to worry about. There's probably many other changes to our environment overall that we don't know. And also I should be clear, there's probably more than one environmental factor at risk here. To try to find all those environmental factors that increase the risk of autism, to find the changes, is really hard. I liken it to finding an unknown number of needles in a field full of haystacks. So there's a lot more work that needs to be done. To me, I'd start by looking at those things which are increasing, that is maternal obesity and prenatal use of different drugs. But I think we need a lot more research on all these other potential risk factors to understand the one or more environmental exposures that might be behind the increase.
Yeah, Tom, that's an excellent summary. And I just want to dive into a couple of the issues here. The first is the one that you kind of closed on, which is that there doesn't have to be just one pathway, right? Like we know that, in medicine, we often talk about something called the genotype and the phenotype. So the genotype is what is like the code that was written into your biology that might determine why you are different maybe than somebody else, or why one bacteria is different than another bacteria. The other is we talk about the phenotype, which is how does that actually get expressed in the world? And so if you think about, if you're an average viewer out there, think about a recipe, right? A recipe in one set of cook's hands does not necessarily turn out the same way as the recipe in another different cook's hands. And that is the way our world works too, because the way you're interacting with the world, the types of things you're putting into it, how you're managing it will change over time. So I guess the first question I have for you is how do we tease apart this issue or think about this issue that there are multiple different pathways? I think that is probably one of the reasons that people are so drawn to a theory like vaccines, because it seems like an exposure that everybody is getting, therefore that must be it.
Yeah, people often look for a single solution, and diseases rarely occur from one thing. They usually it's a combination of factors that are coming together to make something that occurs. The way that we try to tease this out is to do studies on children who have autism, comparing them to children who don't have autism, try to look into those factors that we have some theories might be at risk and see if there are differences. Are kids who have autism more likely to have a mother who is obese? The answer to that is yes. Okay, well, that's a clue. That may not be the answer, but that is a clue. Are they more likely to have a mother who has used certain medications during pregnancy? Maybe. There's an awful lot of there. I've talked to specialists that really worry about pesticides that are not only in our air and water, but in our food. Absolutely, positively. Those are hard to measure. We need a lot more research on that. These are the kinds of studies that need to be done, and it take a long time, and a lot of them over time coming together to create a more clear theory.
Yeah, I mean, I think one of the challenges, one of the reasons I like working on infectious diseases is that we have laboratory tests, right? And tests are, in the infectious disease world, the test can tell you why the patient is sick. They can point you to the therapy that you need to do, and they can give you a really clear likelihood about when the patient has been cured of it. But as we talked about in our last episode, where we talked about, trying to tease out whether there's an autism epidemic, until we're able to sort of classify the disease into different forms, it becomes very challenging, right? Because we're looking at all these factors and we're looking at one group of people when in fact autism may be 3 or 4 different types of conditions, and with different pathways, different risk factors leading to different conditions.
Yeah, and I mean, this is an area that I think we need more government structure for this sort of research. I think the attacks on the CDC recently are terrible because they're ultimately the plans are to eliminate the center that would be looking at this. And I'm not sure what the implications are of the attacks on the NIH, but they might be undermining the one issue that our Secretary of HHS says he really cares about. We really need to have objective scientific research on this.
Yeah, and we'll get to that. Maybe we'll close on that topic a little bit. I want to, because I have some concerns and thoughts about even our conclusion about autism and epidemic. So, but before we get there, I wanted to tease a little bit more of this issue about the environment, because one of the challenges I have with exploring this hypothesis is what you and I know very well of, which is sort of the appeal to nature fallacy, which is you often see in people that reject modern medicine and public health initiatives, this notion that somehow natural remedies are better. And they have a broad definition of what's natural. They essentially, will define supplements that are made by very big for-profit commercial entities as natural, but chemicals that are all made in different factories by also for-profit companies as big pharma and dangerous. When in fact, there's danger potential on both sides and things. And so I worry sometimes when we talk about chemical exposures that people will intrinsically fall into the camp of saying, well, as long as I take vitamins and supplements or eat, organic foods, and that'll keep me protected. But I think what you're getting at here is the notion that we expose our body, including people who claim to be all natural, to a tremendous amount of biological, of chemical agents that may be dangerous to us. And that includes, as you mentioned, pesticides, but it also includes beauty products and hair products and all the things that we see in our drugstores. And I don't want to scare people, because I certainly use all those. My wife, my 3 children, they all use them as well. But these are important areas to explore further.
Yeah, I mean, you think about it, the world that we live in today is very different from the world that people lived in 20 years ago or 40 years ago, and everything about it. And so it's very hard to say what in that environment is having an impact on this. So we need careful study on this. And it may turn out to be things that we all consider to be unnatural, like pesticides, but it may be something that people consider to be natural or something nobody even thinks about at all. Or again, more likely, there's probably a few things at play here.
Yeah, and I think one of the biggest concerns I have now, and sort of getting back to what I was mentioning before, is, while it's helpful and important for federal health officials to focus on important conditions like autism and developmental delay and intellectual disability. It also has to be done in a way that is based in science and also expresses empathy and concern and care for the people that actually have these conditions. And one of the things that really struck me about the sort of press conference that RFK Jr. had about this topic is there seemed to be an entire dismissal of people with autism as somehow a waste on society, right? And we have heard this language before, the language of eugenicists, that somehow there are certain percentage of the population that is a drag on society and that is, dangerous, and then we need to rid ourselves of them. But we know that autism occurs on a spectrum. We have people in our lives. I've had friends in my life that are on this spectrum of disease. I have friends of mine who are parents of children with kids who have severe autism. These are human lives that have value. And I worry that some of the rhetoric that's coming out about trying to identify and address the autism epidemic, it reminds me a lot, as we referenced in the last one, about, let's say, HIV, for example, as well, the people who have HIV, their lives are worthless. They did it to themselves, or there was some harm associated with it. And so I really worry, first and foremost, that there's not enough empathy being expressed, in this administration towards the parents and the people with this. And they're simply viewing it as a problem that needs to somehow be eliminated as opposed to providing the support and care and love and compassion for the people with this condition, many of whom are incredibly productive members of society.
Yeah, it's sort of a false dichotomy of whether you should be focusing on providing services for people with autism versus doing research on how we prevent this. Clearly, we need both. People wouldn't prefer to have a child with autism, but certainly we have plenty of folks with autism that are here. They're going to be productive members of society. We need to help them out. And I would say whatever research we do on this absolutely needs to be scientific, objective, open to the critique and criticism that is part of the scientific process. That's not what Kennedy said that this HHS commission is going to be doing. He's assigned it to someone who's already made the decision that this is all about vaccines, who's not scientific at all. And so whatever process that they go through absolutely needs to be wide open. It has to be something that is open for people to understand what their methods are and to be open to critiques.
Absolutely. And that is the second area that bothered me the most about this prioritization of autism. The first was, what seemed to be a lack of empathy and concern for the actual, productivity and lives of the people affected by this condition. And the second is the absence of rigor in the scientific approach. First of all, is obviously the presupposition that it must be related to vaccines, which we now know fairly definitively it is not due to. And second of all, this notion that somehow we can solve an incredibly complex scientific problem by September 2025. We're recording this in April. That's just absolutely absurd. There is no complex scientific problem that can be solved that quickly. And anybody who claims that they can is not telling you the truth. And they are not sincere about actually finding out, keeping an open mind and finding out and exploring all the potential causes.
Yeah, I welcome more research on this. I don't welcome, though, research where people coming in with an established opinion about this.
Yep. And it appears, at least from the news reports, I'm not sure how well verified that they are, that, RFK Jr. is planning on hiring a conspiracy theorist who has been found by Maryland authorities to previously be practicing medicine without a license, that they're going to be, they're going to be the experts that are going to solve this problem, right? And this is an enormous problem. If we really want to address this, if we draw the conclusions that you and I have with an objective, rigorous view of the data, that there is in fact an autism epidemic, that the cause is likely to be some combination of genetic susceptibility, that means you have a little vulnerability, combined with some additional hit from some exposure that occurs either during conception, during the pregnancy, or maybe soon thereafter, that if we really want to explore all that, it's going to have to be done by people with the rigor and the expertise in how to do this.
Yeah, and the scientific process is all about people challenging each other on the facts and on the interpretation, and listening and responding to that. And the end of that process, the truth gradually comes out. It doesn't work for people to say, no, we already know the answer. We're not listening to any critiques. And here's the answer.
Okay. So Tom,
I hope this is an open process where we can all have a conversation about it.
Yes. Okay. So before we close up, let me ask you the question. You are suddenly the king of public health resources and things. If you could, design studies, what would you be? What would be your primary hypothesis, and how might you go about looking at this problem?
No, I don't think I would design one study. I think I would go to several groups out there and say, okay, tell me what your best theories are, what you think are the most likely exposures have that increase the risk here. And then let's design studies, let's design multiple studies at the same time that explore those hypotheses. And then be prepared once you get the answer that we're going to have to do another wave of studies. It's going to be an iterative process. And some of that's been done, but that's going to have to continue over time. Science doesn't move quickly.
Yeah, absolutely. And hopefully that would be, combined with, providing the resources through our, healthcare, through our educational systems, through our welfare systems. A lot of those systems are being torn apart, right? And so while that research is being done, that would obviously need to be paired with, supportive services that are essential for the parents and caregivers of children who have the severe impairments, right? The ones who really do suffer the most, as opposed to those who are really more in the sort of divergent spectrum and are pretty high functioning.
Yep.
Great. Well, Tom, I really appreciate you joining me. And to all of our viewers out there, thank you so much for watching this special episode of Thermometer, our two-part series on the autism epidemic. Is there an epidemic, and what the possible causes are? As you've seen, you don't have to be an expert in behavioral health to probe these issues, but you do need to approach them with an open, honest eye, and to apply, rigor in how you look at these problems. And that's what I hope we're bringing you here on this channel. So if you like what you're seeing, please hit the like button, please hit subscribe, and we'll see you next week on Thermometer. Thank you for joining me, Tom.
Thanks.